state epidemiologist. We've just got some opening announcements from communications. Andrea?
Yeah, just to let everybody know, this meeting will be recorded and will be posted to the DHHR's YouTube channel after this meeting is over. And for all media, if you could just hold all your questions till the very end of the meeting. Even if you want to send me some questions, just make sure I call on you at the end. You can do that as well. And that's all I have.
Thanks so much, Andrea. And I apologize for having to cancel last week. We had an interim session with a bill come up at the last minute that several of us had to attend to at the last minute. So appreciate everybody's flexibility as we are still moving through some unprecedented times in terms of the pandemic. So with that being said, we'll go ahead and get started with today's agenda with a quick EPI update. I'm going to attempt to share my screen. Someone could just let me know when you see my slides.
I can see it, Shannon. Thanks.
All right. So this is our epidemic curve for the current outbreak here in Kanawha County. This data is reflective as of October 7th, which reflects an increase of 2 cases of new HIV diagnoses since we last met in September. One was diagnosed inpatient and the other by West Virginia Health Right. Although there was 2 new cases identified since we last met, the total case count only increased from 84 to 85. And this is because as part of our routine data cleaning from a surveillance standpoint, a case from 2019 that was originally reported from Kanawha County, but then later geocoded, the address actually belonged to a neighboring county. And so this is why there's just an increase of 1 case. Currently, 31 of the 40 cases that have been identified in 2021 in Kanawha County have been associated with injection drug use. And just as a reminder, this data is representative of Kanawha County residents or individuals who were homeless in Kanawha County at the time of their HIV diagnoses. Next, looking at the epidemiology of this outbreak, there's been no real shifts in terms of the epidemiology of outbreak cases at this point. There's slightly more males than female. Just under 80% of the cases are between the ages of 20 and 40 years of age, with 47% of the cases reporting being homeless or unstably housed in the last 12 months, and 86% are co-infected with hepatitis C. Hospitals remain the setting where the largest number of individuals have been diagnosed with HIV at 46%. And then lastly, looking at medical case status of the Kanawha County outbreak, in terms of care status, this has remained relatively stable across all categories. Of note, there is an increase of 1 individual ever linked to care since last month, and an increase of 2 people currently engaged in care, and the number of virally suppressed individuals at last test remains at 25. And then just a reminder, if you haven't checked out our new website, we do post the agenda for the upcoming meeting, as well as any materials related to the HIV outbreak on our website at hivawarewv.org. All right. Any questions related to just the brief EPI update that I provided folks? Okay, not hearing any, we'll go ahead and move through the agenda. I believe we've got Suzanne. Hey, Suzanne, the division director, to give an update on the DIS response plan and just some of the activities that are currently ongoing within the division.
Sure. Thank you, Shannon. Good afternoon, everyone. Just wanted to provide a high-level summary of some of the response activities that we've undertaken. And due to specifically around DIS or disease intervention specialist capacity, we have evaluated we recently had opportunity, CDC provided some additional funding specifically for DIS workforce supplementation, and so to all states. And so in order to utilize that funding, we evaluated the statewide data on county vulnerability and infectious disease patterns to increase capacity for DIS and linkage to care in efforts to address the needs in Kanawha County, as well as implement prevention activities in other areas of the state. And so currently we are creating positions for another DIS that will be assigned to Kanawha County. And we're also funding for linkage to care specialists, or excuse me, linkage to care coordinators that will be around the state, building off of the model that was implemented in Cabell County in 2019, that has led to a lot of success in linking and helping link and retain individuals in care. The other prioritized initiatives that we're working on from the CDC EpiAid recommendations are an educational curriculum for stakeholders and providers. We're working with the Mid-Atlantic AIDS Education and Training Center to develop a virtual curriculum that will be interactive, but will be done virtually, not in person, for providers and other stakeholders. And the proposed date for those first trainings are in mid-December. That the first of those will be ready and kick off. And we have also worked with the West Virginia Hepatitis Academic Mentoring Program. So this is a program that through WVU that works with, provides mentorship and training for primary care physicians in rural areas to be able to learn about and be able to provide treatment for hepatitis if they would like to do so in their practices for patients, especially those in rural areas. And so they have agreed they are going to integrate PrEP for HIV as a part of that curriculum train providers on counseling their patients about PrEP and being able to provide PrEP as well for their patients along through that mentoring program. The second prioritized activity is integration of testing in jails facilities. And we are currently working in conjunction with the Division of Corrections to develop a strategic plan for an opt-out testing program for HIV and hepatitis C on intake at jail facilities. So there'll be more to come on that. And the third priority area from the EpiAid was integration of testing with hospital emergency departments. And we've been happy to partner with CAMC on that. There was some initial meetings and discussion about some models and assistance, technical assistance for them. And then that's right around the time that the fourth wave of COVID hit. So understandably, their resources and ours have been taxed since then, which has kind of delayed that any further activity on that aspect.
You able to draw
so I think that's all I had for it's just sort of a high level overview of the priority. There's lots of activities that go on, but those are the high level overview of the priority activities.
Thanks, Suzanne. I'm excited to see the development of that curriculum come available later this year.
We don't have to
I could remind folks to to mute your phones if you're not speaking at this moment. All right. And then I believe we've got some partner updates for this afternoon. I see Angie, so I'll go to Health Right first for an update if that's okay
Sure,
with you,
I'll
Angie.
give you like the 3 months totals and then I'll give you September. So
Sounds good.
for 1 second here, I've got my notes. For the 3 months, July, August, September, and this is exclusively in outreach, street outreach efforts, not anything inclusive inside the clinic. 702 people were tested for HIV. Of those, 6 were positive, 3 were known positives, and the other 3 were transported consequently to Ryan White. 2 of those people were started on HIV meds at the Westside Clinic, and then were transported to Ryan White. 1 was transported straight to Ryan White for same-day services. Follow-ups will be at the Westside Clinic. Appointments were made. Also, as a side note, we did 483 Hep C tests, of which 101 were positive, with referrals made to them to the main clinic, or our Westside Clinic, for our Hep C treatment clinic. Pulling out the numbers separately for September, it was 203 HIV tests. 4 were positive, but 3 of those were already established with Ryan White. 1 was new, and we took care of them and sent them to Ryan White. We have 61 people newly on PrEP. Of those, 32 identify as drug users. And the bulk of our effort and the new people on PrEP has been through our mobile street medicine unit with our HIV PrEP nurse practitioner on board, and reaching a lot of people there. So they're continuing to follow up and remaining on PrEP.
There's some really great numbers considering we were, in the middle of that surge, and the fact that you've got 61 new individuals on PrEP. That's pretty inspiring. Thanks for that update. And then Christine was not able to make it today, but I believe Denise was supposed to be jumping on.
Yeah, hi, I'm here.
Hi.
Hey, how are you?
Good, thanks.
All right. Just to kind of echo that, so I don't have all of our stats, kind of a rough report. Our probably main intervention that we've been working on has been some of our community outreach, utilizing our van/mobile, and we have been able to see 3 patients there that we were not able to see in the clinic, and have been able to get them started on meds. So we are now in the community 3 afternoons a week. And we're still trying to figure out the best locations, but twice we're on the west side, and then once we're in on an afternoon. So we're kind of still strategizing some of that. But like I said, we have seen more. We've probably seen about 5 or 6 patients, but 3 of them were not in clinic, so that we considered a success. We're still seeing quite a few challenges working through the emergency department, as you mentioned earlier, and we actually have a new EIS employee to put in that area once we're kind of able to do a little more work there. And right now she's working with the QRT on the ground, and her name is Mackenzie Kemp. So if any one of you have had a chance to meet her or not, just introduce yourselves and let you know that she's there. And then also we have a couple of other positions that just to be aware of that we're looking for, or if you have anyone that you feel are candidates. But we are looking for a community health worker that would be available to help clients just kind of with life activities, getting people in, getting IDs, signed up for insurances and those sort of things. We also are looking for a pantry worker because we have our Ryan White pantry, and then we are looking for a recovery coach to add to our team as well. That would work partially in the community and then as hospitals. And one of our nurse practitioners retired, so we have a position posted for a nurse practitioner as well. So that's just kind of my point at this time. Thank you.
Thanks for that update again. Really encouraged with the mobile outreach that is going on in the community. And, unlike some other infectious diseases, with the exception of COVID, responding to an HIV outbreak is, we're in it for the long haul, and it's going to take a long process to get where we want to. Jennifer, I see you've popped on your camera a couple times. I'm guessing you have a couple of questions or maybe some comments.
Yeah, if you don't mind, Shannon,
Sure.
Commissioner Carper wanted me to ask a couple of questions to Suzanne, if possible. She had mentioned that there was additional funding that had been received by you all. Do you know how much the total amount was that was received?
Yes, so the DIS supplemental workforce grant was for that we received, it was for $1,070,000. And that's being utilized to fund additional DIS capacity in Kanawha County as well as other areas of the state.
Do you know what percentage of that actually is being used specifically in Kanawha County?
I don't right off the top of my head.
Okay. And then when did you all receive that additional grant?
Forgive me, it's grant season. There's been a lot. I believe the award was received in, I believe it was in, I'm sorry, I don't know if I'll have to look. I'm happy to get that and get back to you because I don't want to misspeak. It's we've, like I said, it's grant season. We've been writing so many these last few months. I don't want to misspeak. So I'll get the date and get that back to you.
Okay, and then you mentioned a new DIS person would be hired. Have they been hired at this point, or are you still in the process of hiring them?
No, they are not. We're in the process of working through the state process to have the position created.
Okay.
So that we can then post and hire.
And how long do you think that will take?
I don't know. We have submitted the request. It's for the position and are awaiting the creation of the position. So that's a process we just have to work through with the Division of Personnel.
Okay, and would that person be housed, their office be at DHHR or the health department, or where would they actually be located?
At the health department, we have Kanawha Charleston has provided space for this will be the third DIS. We will have at that point then have 3 DIS dedicated to Kanawha County.
Okay, great. That's all I had. Thank you, Shannon. Thank you, Suzanne.
All right. Are there other folks on the line who want to give a partner update?
Hey, Shannon, can I add one thing? I forgot.
Sure. Yeah.
We about 2 weeks ago, we started another outreach spot on the west side at Orchard Manor. So we're going there every Tuesday from 11 to 3. Actually parked within, so we're hoping that we'll get even more numbers there. I just wanted to add that. That's something new.
And you're there from 11 to 3, you said?
Yes, and that's with the nurse practitioner and the mobile medical unit. So we're also getting a lot of people with the HIV outreaches to do COVID vaccines and flu vaccines and everything else. So that'll be the whole unit for medical and everything there.
Great. Did we have other folks want to give a update on activities in the community? Any topics folks want to discuss as a group? Quiet group this afternoon. I can respect that. It's a lunchtime meeting. All right, well, if nobody has anything else they want to talk about, we'll go ahead and sign off for today, make it a quick meeting. You know, we like to regularly have these meetings so we can touch base and provide some timely updates.
We
And I'm
have
going
some
to pass
questions
it
from the
over.
media.
Okay. Folks are welcome to sign off or listen to the media inquiries. You guys have a great afternoon. Go ahead, Andrea.
Katie Coyne, do you have a question? You said you had a few that you wanted to clarify.
Yeah, nothing too big. I am wondering, with only one case between our last meeting and today, that seems to be the lowest that I can remember, at least since we started doing these in 2019. Does that tell us anything? I mean, are we slowing at all? Is it too early to tell? Is it not a pattern at this point yet?
I mean, I think it's safe to say that it's not a pattern at this point. You know, we've been up against this significant Delta surge that has resulted in cancellation of testing events, although there's continuing to be great activities and testing events going on in the community. We have had to unfortunately cancel some events due to COVID and weather. And I think just, you know, a single month of a decrease in the number of cases identified doesn't really signal anything at this point. But folks are always helpful. But as I said previously, we should be prepared to be in this response for the long haul. This is not an easy task. And on top of that, we're still dealing with the COVID pandemic, which makes things even more challenging.
Right, and that was you actually answered my next question, which was going to be the surge in the last 2 months that affected testing at all. And I imagined it had a little bit at least.
Unfortunately, it has. The team's done a really great job in terms of trying to navigate that. But that's just, you know, an unfortunate event of, you know, the pandemic. But I think we're all, you know, trying to get comfortable with still, but
Right.
it's always a challenge.
And then, you know, we talked, I don't know if Suzanne is still on here, but we spoke about the initiatives that the state is undertaking right now in response to the CDC recommendations. You know, one of those top recommendations on there, which is what I hear partners here talking about a lot, is the access to clean syringes. I know that's a kind of touchy subject and there's a lot of politics at play there as far as state legislation, but you know, is the state looking at access to syringes at all, or syringe distribution at all, even under the purview of SB 334?
Yeah, so what I can say is the state is currently trying to prioritize their efforts in response to the CDC recommendations and is fully supportive of working with community partners and the local health department to support any programs that would be in alignment with our current laws.
And the programs that have been announcing that they've been closing, I know, you know, there was Mercer County, I think that's most recent, a few up north, and obviously Kanawha doesn't happen anymore. Is DHHR reaching out when those programs run through health departments do announce that they have to close or that they're closing down because of this new law and trying to work with them in any way, or is it kind of revisit it later?
Sure. Unfortunately, I do not have the program contact on this call who can appropriately address that. I'm not that intimately close in terms of working with the specific programs if the event happens where they do have to close, but we are happy to get a written response to you through Andrea if you'd like.
Yeah, that's fine. I wanted to ask to make sure. And then my last thing, you guys mentioned working with the HIV or the hepatitis program at WVU to train rural doctors, and that PrEP was going to be a part of that, which I think is awesome based on what I've talked to from rural doctors who were just like, we wouldn't know what to do if we did get a case. Is there any other support being offered to more rural doctors where we might expect spread from Kanawha and more kind of transient populations? Or are we thinking about that at all on top of the hepatitis stuff?
At this time, I don't have anything to add. Suzanne, do you have anything to add from a planning perspective that I might not have that detail on?
Yeah, I will say just the training curriculum that's being developed is something that I think will also benefit providers in especially rural providers that don't see these types of things very often. It will range. There'll be several modules in it that will work or talk about sort of a general overview of HIV, testing, and all the different aspects, but the specific support around offering either clinical services is all we have at this moment is the partnership with West Virginia HAMP.
Okay, that sounds good. Thank you guys so much for answering me. I really, really appreciate it, and you keeping the availability open. So thank you.
Do we have any other members of the media who want to ask questions?
Okay, not hearing any. We'll make sure that we follow up with the county commission related to the grant question that we need to respond to in terms of the percentage of DIS capacity going to Kanawha County. And then Katie's question about, forget what. Suzanne, help me out.
The support being provided to harm reduction programs that are
That's right. Yes.
closing.
Thank you so much.
Or planning or talking about closing. Yeah.
Thought just went out my brain. Thanks so much. All right, everybody. We'll talk to you guys later. Have a great afternoon. Enjoy this beautiful fall day. Talk to you later.